as you all know, a really key committee for our city, and there's a long list of items that we need to talk about. Every month, we have to kind of sort through the most pressing issues. And this month, I felt a very compelling and pressing need to talk about specifically mental health for our first responders. I really appreciate the first part of the presentation about the services that our first responders are providing to our community. But really want to focus today on mental health services for our first responders. I think it's maybe the nature of the work that you do, the calling that our police officers and our firefighters have to be selfless. So you want to talk about what you're doing for the community, and we do really appreciate that. And there's incredible work that's being done. But today I really want to focus on our first responders, airport police, park police, SAPD, and of course our firefighters. What strikes me is, you know, we all have heard, and I don't think we're talking about the fact that we've had 7 police officer suicides in the last 20 months. And that's 7 officers for whom all these systems that are incredible and very helpful to many, but these systems didn't work. So they fell through these gaps. That's really where I think we need to spend our time, is figuring out how to fill those gaps. Why didn't they seek the help? Did they seek the help and it didn't work for them? Can we enhance any of these programs for both police and fire? Can we partner with outside agencies so that maybe a police officer or a firefighter doesn't feel like they have to go internal if they don't feel like that's something that they want to do or that they trust? We've all been talking a lot about mental health. The last 2 years has been a lot of conversation about that. We've allocated ARPA dollars towards it, and it's all been focused on our community. And I think sometimes we tend to forget that our police officers, our firefighters are a part of this community. They are, as much as, you know, I think that they don't always like to seek out help because they're tough women and men. And they are very tough, tougher than a lot of us that don't do that job. But they're still human, and they're still dealing with the last 2 years of pandemic, and they're still dealing with all the other pressures that we all have every day after seeing sometimes very horrific things on the job. So I really want to kind of be in that space today where we can figure out what to do next. The committee is a fantastic. I'm very grateful that y'all had the foresight to have a committee and really talk about it, and including police officers, including the leadership, including our unions. But I really do want to be sure that we're being honest about what's happening and what's not happening. And so, of course, I want to be a part of that conversation. I've been talking about mental health care for our first responders for a long time, but with these numbers, it's just been something that we all have to talk about very openly. So I appreciate, again, your time here and talking about it today.